In our mouth, we have something precious, our natural teeth. Teeth are hard on the outside, but on the inside is living, sensitive, soft tissue, the dental pulp. The dental pulp can be injured in many ways, including accidents, dental treatment, and tooth decay. An injured dental pulp can become infected by bacteria, inflamed, and painful. If not treated, this infection can spread down the root to cause an acute painful abscess with a swelling or an inflammation into the bone surrounding the tooth, named apical periodontitis. When pain arises and you need a treatment, there are two simple options: to lose the tooth or to preserve it with endodontic treatment. Endodontic treatment encompasses a range of procedures to relieve pain and avoid tooth loss. In all endodontic procedures, strict asepsis is needed. Vital pulp treatments aim to relieve pain and maintain the pulp in health. These include removing tooth decay to prevent pulp irritation, or removing a small portion of diseased tissue before sealing the tooth with a material that will be kind to the remaining dental pulp. When the dental pulp cannot be preserved, root canal treatment can be performed. This is a safe and highly effective way to alleviate pain and save teeth with a strong scientific basis. During root canal treatment, the inside of the tooth, the root canal, is cleaned, disinfected, and filled. Root canal treatment doesn't always work, but it is often possible to repeat the treatment, cleaning and disinfecting the inside of the tooth once again, a procedure called root canal retreatment or secondary root canal treatment. Surgical endodontics, or root end surgery, is highly effective for preserving teeth and can be undertaken to correct problems that cannot be solved by other methods. The root end is accessed by surgery through the gum. The infected apex of the root is removed and a filling placed in the end of the root.